Hi, my name is Dr. Virginia von Schaefer. Today I'd like to spend a little time talking about a kind of hot topic. It's called resolvins, okay? People are kind of trendy in talking about what they do. What are resolvins? Well, the resolvin class of molecules is basically essential fatty acids. And it's not anything new to say that good essential fatty acids will help fight inflammation. However, we now have a name to classify it and something to talk about. The bottom line is essential fatty acids are very, very important in our metabolism, and we need to be careful in how we choose them. There are two basic ones, the DHA and the EPA, and of course we're familiar with this if you look at a bottle of fish oil or some essential oil capsules. There will be a certain content of these two essential fatty acids. However, it's very important to know that DHA of the two is the only one that can uniquely feed into the anti-inflammatory cascade of reactions. EPA, on the other hand, can cross over and go towards inflammation. So when you look at a product that you're going to choose to take, which you should, you want to have a much higher content, a 2-to-1 ratio between DHA and EPA. Otherwise, you may be inadvertently feeding the inflammatory pathways instead of blocking them. This is a very important thing, and I want you to, when you choose a product to use, to scrutinize that ratio. We have one at VVSMD that we have made for us, and it's probably the highest content of DHA on the market today. It's really great, and it's in a capsule form, which doesn't have the fishy aftertaste of many of the fish oil content products that you see in the market. However, these oils are not the only way to fight inflammation. There are other root-based, plant-based things that can help very, very much. And one of the things I find very, very helpful is something called bicalin, or extract from skullcap root. And this is from Chinese medicine. It's an excellent treatment, and it can be used in an oral or liposomal form as well as IV. And it incidentally also blocks the mTOR mutation pathway in cancer cells and crosses the blood-brain barrier. So it's very handy in treating a lot of different things. It's very well tolerated and extremely effective. Other things such as olive leaf extract also can be used to fight inflammation as well as the growth of viruses or bacteria, and should and can be used very, very effectively altogether. So I want to bring up the topic of why can we treat cancer well just by treating inflammation. And I have many patients who come to me and they're in a stage 4 cancer situation, they're extremely ill, losing weight and looking like they're going to die quicker than everybody else. Okay, these patients have extreme inflammation. It may or may not be registered by the typical labs like the CRP or the ESR, erythrocyte sedimentation rate, but sometimes it's just in the body because there are too many surreptitious infections in addition to cancer, and the immune system is overloaded. So one of the first things we can do to help these people is cut inflammation. And time and again, I've seen people who were extremely ill, and I didn't do very much of anything to treat their cancer. I just cut the inflammation and worked on killing the viruses, and they were 100% better in a short period of time. And this is another reason why too much killing at once can be a problem. So when you have cancer cells and you want to get rid of them, or you have viruses or bacteria like Lyme bacteria and you want to get rid of them, you have little bits of killing are going to be much more effective along with boosting the immune system and cutting inflammation. and the result will be much, much better than kind of overkill or trying to get rid of everything all at once. So I just want you to bear that in mind. Thank you.